From Florida, Mr. Ross, 5 minutes for opening statement.
Thank you, Chairman Pitts and Ranking Member Pallone Committee for taking the time today to hold this hearing to highlight the significant threat facing the Medicare Advantage program. In 2012, health care spending in the United States accounted for 17.2% of our nation's economic output, equal to $8,915 per person. Mr. Chairman, these statistics tell me that for a country with arguably the best health care in the world, we have yet to properly align patient and provider incentives to enable our health care system to be cost-efficient, highly accessible, and ultimately to achieve self-sustaining cost containment with little need for government intervention. More than 3.5 million Medicare beneficiaries reside in my home state of Florida. 1.2 million of these beneficiaries have chosen a Medicare Advantage plan over Medicare's traditional and more costly fee-for-service structure. In fact, since 2008, the state of Florida alone has seen a 30% increase in the number of Medicare Advantage plan beneficiaries, while currently 30% of our nation's Medicare population have opted for a Medicare Advantage plan, serving as a clear testament to the high level of patient satisfaction the program has achieved. Among the many satisfied Medicare Advantage plan beneficiaries in the state of Florida are Michael and Sandra Cox from my hometown of Lakeland, Florida. Michael and Sandra did what so many Medicare Advantage plan beneficiaries have done since January 1, 2014, writing to their members of Congress expressing a mix of anger, confusion, and panic at the senseless cuts that have been made to this effective program. Sandra and Michael wrote, quote, "Please explain the logic of the Obamacare cuts to Medicare Advantage. My husband and I have never experienced such a high level of satisfaction with our health coverage as we have with our Medicare Advantage plan, and all with a much cheaper monthly premium." Unfortunately, Michael and Sandra learned on January 1st that the doctors that they had been seeing for more than 10 years were no longer available under the Medicare Advantage plan as a result of the continued cuts to the program. They would face a full out-of-pocket cost. Should they choose to continue seeing those providers that they had come to know over the last 10 years and their health status they treated so well. Mr. Chairman, was it not the Administration's goal to ensure patients develop a relationship with their provider, resulting in better prevention and a more consistent continuum of care? Unfortunately, these cuts to Medicare Advantage, like so many other health care-related actions by this Administration, are contradictory to the purported message. Even more baffling, past cuts have already crippled innovative programs like home health visits, instituted by Medicare Advantage plan sponsors to ensure our seniors are able to maximize the value of health care services they receive. Going forward, additional cuts of this magnitude will devastate medical innovation in areas like telehealth that show great promise for increasing efficiency and cost containment in Medicare Advantage and the health care system at large. Overall, health care spending and utilization habits are a critical threat to America's declining fiscal health. If we are to successfully curb health care costs, we must preserve and enhance the Medicare Advantage program because of its proven ability to achieve cost efficiency while maximizing patient access to high-quality health services and providers. To be more specific, data collected between 2003 and 2009 showed service utilization rates in areas like emergency department use and ambulatory surgery were 20 to 30% lower among Medicare Advantage beneficiaries than traditional Medicare. Overutilization of health care services, however, is only one facet of health care cost growth tempered by the Medicare Advantage plan structure. Although this current Administration has tried to discredit the power of market competition in creating organic, self-sustaining incentives for patients, providers, and insurers alike, the facts always prevail. Artificial market controls put in place by the Federal Government lead to more out-of-control health spending, as we have seen time and time again. As far back as 1995, health economists have shown that combining coverage like that offered by Medicare Advantage with appropriate patient incentives leads to an avoidance of excessive doctor visits and tests, as well as more engaged patients seeking the best value for the health service they need. In this same vein, I was proud to introduce H.R. 4180, the Preserving Health Savings Accounts for Medicare beneficiaries, which would allow for this consistently proven economic strategy for reducing health care costs across the spectrum. My legislation would incentivize younger Americans to establish health savings accounts with the promise that upon being Medicare eligible, they are able to transfer the HSA funds into a Medicare savings account. Simple enhancements like this one will help both Medicare Advantage and the entire health care system achieve organic alignment between insurers and patients and providers, and creating a powerful, self-sustaining cost containment pool. Patients have more control over their health care dollars, increasing awareness of reasonable health service costs and quality options, while also actively engaging providers to offer the highest quality service at the lowest reasonable cost in order to earn a patient's business. Mr. Chairman, this is what value in health care looks like. Unfortunately, through continued cuts to the Medicare Advantage program, this administration will eliminate any possibility we currently have to build upon the Medicare Advantage program success in curbing health care costs, and I yield back.